So hello there, friends. Steve Taylor once again, lead advisor and founder of Merited Wealth. And thanks for joining us for another episode of our podcast. And we have a couple different formats that we use for our podcast. One, we call it the Do It For Yourself podcast, where we interview a founder of a business. And the other format is where we go through and talk about a substantive matter, whether it might be with an expert. And so we're going to try to kind of mix these two together today. We have a really great guest and a really timely topic. It's a conversation that's been coming up a lot in my practice. It's come up a lot in past years, and it's something really great, and everybody needs to talk about. And we're going to try to, present it in a different fashion here to help you out with these conversations for you and your family. So my guest is a wonderful Lily Vittayarukskul. Excuse me there. It's a little bit of a mouthful. But Lily, tell us a little bit about yourself and the company that you created.
Yeah, absolutely. So I'm the founder CEO of Waterlily, and our core problem that we actually focus on is how can we help families mitigate the devastating effects of caring for aging loved ones. And so I could share some learnings. We started in the healthcare space, learned a lot from hundreds of families. It's a topic that sits near and dear to my heart since I had a personal experience with it. And ultimately, we realized in order to, really help families improve outcomes on this topic, we need to get them to plan early enough. And so we built out AI financial planning software as a way to motivate families to build a long-term care plan early enough in order to solve for the affordability and to actually reduce family burden.
Yeah, and it's a really cool product what you guys have out there. For those listening, we'll put links to your website and everything in there. It's a really wonderful way you're thinking about it in a really different way. And let's start, Lily. It's really interesting when I interview a lot of people about the business that they started. Many times, we'll say, well, why did you choose the business that you started, right? And for you, it's a personal passion as well, that you're able to turn into a business passion, which is not always the case with many entrepreneurs, but for you, it is. Tell me a little bit of, about that, about your personal experience, and really walk us through then, a little bit of how it led you to coming to wanting to start Waterlily.
Yeah, definitely. So what I will share is it was an experience when I was a lot younger that made me pivot my career. So my core passion when I was a lot younger was actually aerospace engineering. I was going to college early, at 14. I did my internship at JPL, NASA side of robotics when I was 16. And I thought, I was fast track, I'm gonna go there and I'm gonna, work in aerospace, as a scientist. But then that's when something happened to my family when I was 16, where my aunt, who's a first generation immigrant like my parents, she lived under the same household as us. She helped raise me growing up. So she was very much like my second mom. And something happened to her where she was diagnosed with terminal stage colon cancer. And so for a little over 2 years, it was nothing short of brutal to navigate her care. My mom was a primary caretaker. We stepped in physically in ways that we didn't expect. We weren't well off by any means, but we paid every penny towards her care without any regrets. Went into quite a bit of debt. And the part that made me really pivot my career to really focus on the problem and the overall problem of caring for individuals is the amount of broken family relationships that actually came from the topic. So from what I learned, every single person in my family and my relatives had a very strong opinion about what the best form of care for my aunt would look like. And of course, we didn't agree. Some people stepped in various forms, but the disagreement caused such deep rifts in my family, where there's just relatives that we haven't talked to in over a decade since that's happened. And so it imprinted on me enough to recognize, wow, I know healthcare is hard, but it shouldn't be this broken, at least being young. And so I decided to pivot from aerospace engineering into healthcare. I kept my technical background, specialized it in machine learning and AI, as well as studied genetics at Berkeley. and essentially, have been leading product and engineering teams at early stage startups to focus on problems, healthcare problems, to reduce disparities, like what I experienced. And I realized about, a decade into building my career, it's been nearly a decade later, and not much has changed for families on this topic. And I didn't see any companies that were thinking about it, from a lens of like, how can we improve outcomes? How can we be more proactive about it? So that's what made me found Waterlily a little over 2 years ago, with the core focus being improving outcomes and mitigating the devastating effects like what my family experienced.
Wow. Yeah, Lily, I want to get back to that. We're going to get back to that a little later when we talk about, giving some advice and some ideas for families here, talking about that. That's so challenging. But I want to go real, quickly first about, the actual starting of the business. You're in the industry. You're doing all this different work. You're seeing something. You see something that's not out there. How did you go about when you decided this is something you want to do? Walk us through a little bit about the steps that you took to really start it up. Did you go look immediately for capital, right? Did you bring up an idea? Kind of what was your process there? Maybe walk us through the first, maybe the pre-launch, maybe 6 to 9 months, and then kind of, the year after.
So it's so interesting. Like what I'm working on now is not what I expected to be working on. Like 2 years ago, I wanted to focus on what was like my home base in terms of a space, which is healthcare. And so I really like stepped into elder care. I learned a lot about the brokenness there and why it's so difficult to actually get like resources, care resources, and to navigate care, because a lot of the different providers in that space really don't talk to each other, and if anything have competing incentives. And we could always dive deeper there, but for me, I just like, I saw that, and I'm like, is there a way in which we could bridge those gaps and kind of create a quarterback of a kind of care team for this family at the point in which like they need care, which is like what I thought I needed. And I realized there's so much expert advice across all of them. Why don't we just add them together in some way? And so I had that initial idea. I was working actually with an investor like in the space for a while before I decided to like incorporate the company and receive like venture funding, essentially, which is focused on that core problem of like, okay, how can we build out what I would call like, the triple A of caregiving for families. And so when I incorporated and I doubled down on, doing hundreds of family interviews, the core focus there was not so much how can I push a solution to them, but I just wanted to validate that the core themes of problems that I experienced in my family, was also similar to them, or like, there was bigger themes that I should be aware of and solve for, just because I didn't want to build a solution just for myself in that case. So when I talked to families, I was able to validate that, yes, there are so many children of aging parents and, older individuals themselves that were just like, I think about this topic, all the time, but, there's nothing we could do about it. And so I think, I would just wait until it happens. I know that mom's really frail and she's going to need care soon, and I'm likely to step in, and I'm scared what that looks like, but I just want to wait until it happens. So they were able to validate that, I'm worried about the physical burden I'll take on, how that'll affect my career, to kind of step away from that, to like, physically live near my mom, or, financially, just like, hey, I know that my parents aren't well off by any means. I'm making quite a bit of salary for my own household, over in New York. And I'm just gonna, I'm happy to just figure out how to like pay for this. I have no idea what that's going to look like, but I'll just figure it out later. And of course, there's already initial disagreements with siblings about like, who's going to take care of mom physically, who could step in financially. And it was so interesting to see just, the different personalities come out, where you have certain stereotypes that, oh, well, women are gonna, the eldest daughter is going to step in, she may not have like the rights, you know, environments around her to actually like take that on appropriately. And a lot of people assume that she's naturally has these caregiving abilities, when that's really not true. And so it really depends on a personality basis. And I realized, there's a lot of subtleties when it came to like navigating this topic, and the cultural differences and the
Yeah.
psychological differences in each household, which we could talk about how can you be empathetic to that. But I realized that I was able to validate the problem with them, those core themes of like broken family relationships, physical burden, financial. But what was frustrating was that a lot of these families were happy to pay me even up to a few $100s like a month to navigate this topic, but only reactively. And
Hmm.
I knew that as much pressure as I was receiving from investors, from founder friends to just go and build something that people are willing to pay you for, I was so focused on making sure that the company was going to be improving outcomes. And what I felt strongly was that we could only really do that with true proactive planning. And so that's where I saw the initial infrastructure already being built out to my surprise, on the wealth management side of the world. So I stepped away from my home base, stepped into wealth management, and learned a lot more of the dynamics there.
Yeah, no, that's wonderful, Lily, and that's great. I mean, so many entrepreneurs when they start building a certain business, very quickly. I think the best ones, the ones that survive, they realize, hey, what I thought the problem was, or what I thought I was going to build, that's not the case. And the ones that survive adapt with that, and they say, okay, well, the market's saying this, I'm learning this. The ones that stay kind of just focused, say, no, no, I'm sticking to my original vision. Those have a much lower probability of success. So, I think that's, that's wonderful, to hear how you've gone through it, how you worked on it, and how you've pivoted. So let's go to the actual, these conversations, right? And the process and going through it and what your tool is trying to solve for, because yeah, this is something very near and dear to my heart as well, because I was a elder law attorney for many years. And I think what you found through the interviewing of not your clients, but when you went out there to build out the site, that's really how the majority of people deal with this, right? It's very reactive. It's at the last moment, and they have not planned for anything. So when that moment comes up, you really have much fewer options there that are available to you. And so maybe we'll use an example of the challenges that you met with your family. And I would ask, when your aunt took ill and started needing more care, what was that process? What were the conversations or lack thereof amongst your family, to go about and try to talk, number one, amongst yourselves, and then number two, towards your aunt?
That's actually a really, really wonderful question. So what I will share is like, maybe it's like culturally, like as a, because I kind of like identify with like, Chinese, like Southeast Asian culture, where you just like you take care of family members no
Hmm.
matter what, you don't complain about it. And what happened at that time was that like my aunt actually like was helping with my parents like factories at the time. She was like one of the core like workers there. And so when she felt ill, like my parents like did not complain about. They're like, okay, we got to do what we got to do. So the children, like myself, I actually stepped in. I had to step in after school, during weekends to actually like take on the work that like my aunt was doing at the factory. So there's that piece of just like us having to financially make ends meet. And we didn't have this like family member to step in that sense. But what was more important was like for us, we were just so confused for a long time. We're just like, okay, we have this diagnosis. We would ask the doctor just like, what's next? What should we be doing? And my mom just quickly had to pick up, skilled medical care sort of skill set, and kind of take care of the like initial surgery that like my aunt have to essentially like have like a bag, so that there's a external like a different way in which she could essentially process food and whatnot. And so
Hmm.
my mom actively changed that. We saw, and we didn't expect my aunt to be deteriorating health so quickly as well. And so there's ways in which like she'd be more quiet, and you could tell that she's in pain, and we had no idea how to like navigate that. And quietly amongst ourselves, we're just like we're spending a lot like on treatments. A lot of us are stepping in to take on like the work, to take on work so we could financially make ends meet at the same time. And like my mom was just like so worried and stressed all the time about like, am I doing enough for my aunt? I'm like, I have to work, but also at the same time, I have to take care of my sister. And so we saw her kind of like multiple times, like throughout the day, try to go home, go to the hospital, after work, take care of like my aunt's like bandages. And for us, no one trained us on,
Hmm.
you know, how are we supposed to talk to my aunt about this? We kind of like we were tippy-toeing around the household. We were asking, how can we be helpful? And so there was never any room for us to discuss, what we were feeling, what we were scared of, what we thought, really was best versus like we were reactively kind of navigating what my mom was going through as a primary caretaker with my aunt. And of course, I don't think we had the language to even like talk about this. So a lot of it was a lot of silent suffering, is what I
Yeah.
would say.
Yeah, and that's a real huge challenge, really, and that's so many families. Culture is a big deal, right? I'm and down here in South Florida, we are Latin culture, and yes, we take care of our family, right? And you don't really, question about it. But it's, it's interesting. I see that, the younger generation, you come out and you go through this process, and you say, how could this have been done differently? So, really the number one thing that you can do, and it's the hardest thing to do, is you really need to start having these conversations with the older generation as soon as possible, right? Because like you were saying, you weren't talking to your aunt, you didn't know what she wanted, but what if she had told you what she wanted, or a framework for it, right? And you could have started that conversation. Because I used to, tell clients, it was often the children that were coming into my office, and I was talking to them, and they were, saying that, well, the one thing they did say is they never wanted to go into a nursing home or whatever it might be. And I'm like, well, listen, I've never had one person ever come into this office and say, hoorah, it's finally that time. I need skilled nursing care. That's never going to be the case. But it's really the family is at that opposite end, right? To kind of see what's best for that person, right? And whether that person's, well-being, whether they're capable of acknowledging they need the help. So that's a real big point, I think, when people are looking into this, that is the person, are they noticing their limitations, right? Are they acknowledging their limitations? Are they addressing their limitations, right? Are they having those conversations with that person in an open format? And as you mentioned, I guess culturally, that's really wasn't how you guys did it. You just went and did whatever was required. Let me ask you this then, having gone through this now, and let's say, heaven forbid, your parent or something like that, do you think your experience, having gone through this, and the other family members would maybe assist you to maybe be more proactive in talking about it because you've gone through it?
Absolutely. I would say that because myself, like for my family and for many other households that I interviewed, where they've already gone through precipitating events already in some way, they saw a lot of like, well, if I knew ahead of time, how much like financially or physically or whatnot, this could be like how this would burden me in some way. I wish that there was an opportunity for me to share more of my like preferences and to learn more about like what they cared about, because there was moments where, for my aunt, like coming in and out of the hospital or like laying on the couch, and she was just like so weak and so sick, it just, you kind of didn't know how to ask her, how are things going, like what's next. We felt such like so constrained in the limitation of options as well, and so stressed out. So I think cognitively, not only for the caregivers but also for like that care recipient, we were like walking in blind, and it was incredibly stressful. And I've talked to, actually, I'll add another insight, which is I spoke to many children who just finished taking care of like their aging mom or their aging dad, and what a lot of them shared regret around was just like, hey, I was blindsided by this. I love my parents like so deeply, but like I had to step out of like my 300K job like in New York, take care of my mom for the next like 6 to 7 like years. And even then it worsened our relationship because like, she made certain assumptions about how I'd care for her, how much I step in. I even had to pay for her care. And once that was done, I was in a massive amount of debt, close to bankruptcy, and I had trouble going back into the workforce. If someone had told me that ahead of time, that this would actually happen to me, I wish like I would have totally prepared. I would have had those hard conversations with my mom. And I've heard that over and over again from many children that just finished, a caring event.
Yeah. And that's really where it needs to start, right? It needs to start to sit down. Like, kind of the question is, when should you start having these long-term care or conversations? Really, as soon as earthly possible, right? If your parents 50, right? If they're 55, whatever it might be, you need to start opening up these conversations. And even, the biggest challenge, another cultural challenge, right? And that I battle with my clients and with my family, is that, yeah, long-term care, right, is that becomes the big precipitating issue, which causes all the grief, but it's built upon an initial desire to not speak about the finances in a family. right? Many families will come in and say, I didn't know what my parents had. I thought they had things. I didn't know that it took a second, a homeowner, line of credit. So it's really this long-term care and those wishes. I think it goes hand in hand with that financial discussion, because it starts there. Because, when you get into that issue where you need to take care of the person, it's number one, are you going to give the care yourself, or are you going to pay for the care, right? So that's where the financial conversation really comes in. And your example is really a great example, that this one person quitting their job, and that just compounds. The issue. So, talk about a little, Lily, what you're working on, and items like that what you're seeing and what you're trying to do to try to kind of get those families, to start having these conversations as soon as possible.
That's thank you for asking that question. So when I stepped into the wealth management, I guess finishing that story, when I stepped into wealth management, I realized there's some initial planning infrastructure around long-term care. What made me so curious to start to do a lot of interviews with financial planners, wealth advisors, was around the observation that there were so many families that had an advisor, but why did I still see relatively poor outcomes around this event? And so I just thought what is it that advisors may be missing in terms of enough planning tools or the workflow or whatever else that can get families to talk about this event early enough and to make key decisions early enough to make sure that they can actually afford it, or we address a lot of the family burden associated with that. And what I found is there was actually little to no tools that did that. I would talk to talked to many advisors, and I'd share that observation, and every single one of them, essentially said to me, Lily, I love my clients so much, and I want to do the best that I can for them. I'm also a fiduciary, and I do bring up this topic. You're right, but I also dread bringing up this topic because for most advisors, not all of them, majority of them that I talked to shared that when I bring it up, my clients immediately get defensive with me. And I think it's one of two, I think it's two things. The first one is I only have two tools in my toolbox on this topic, Lily, and they haven't been updated in nearly 2 decades, which is national averages and a zip code calculator. And so that's all we really use to try to estimate how expensive could long-term care, really, really be. And we try to share them it's going to be this expensive. Let's start to plan for this, at least as a preliminary step. And of course, the second piece is advisors share the reactance to the client has, which is clients immediately respond with why are you trying to sell me insurance that I obviously don't need? Or two is why are we even talking about this topic? You're talking about some averages here. I'm not the average. I don't think this is going to happen to me, so I don't want this to be a part of my financial analysis. And then that client waits until they're much, much older, where any conversation around insurance is is gone. It's not possible anymore because you can't afford that sort of policies, or you can't qualify for them. Or even when it comes to self-insuring, because there's such a small window of time in which you can make sure you financially have enough from when you're going to start needing care, it ends up also being tricky. So advisors share back to me, they get defensive, but also I feel at a loss because there are many clients that I have that just generally cannot afford either an insurance policy or even to self-insure. And so when I come to them, I have to somehow tell them hey, you can't do these two current solutions, and there's not much, that I could do about it other than saying to you, you just need to somehow be able to afford that in some way. And so that's where I started. And I'll kind of pause there and see.
No. I mean, I think that's great. And for the advisors out there, if any listen to hear this gets put out there, please understand, an insurance policy is not a plan. An insurance policy is not a plan. That's not the only solution. There is so much more that goes into this, right? And so for those that, yes, are fiduciaries and don't want to sell, that is such a small part of it. Because even if you do have that policy, right, how will it pay? When will it pay? All the different restrictions, is it indemnity or whatever items like that? So really for those advisors that really want to really do a better service for their clients, and this, once again, reach out, go, find Waterlily, start that conversation. But there's so many other conversations to have that if they cannot, if it's too late to buy the insurance or they don't qualify for the insurance, that's not where the planning ends. That's where the planning starts. And that's where the hard conversations the advisor needs to have the hard conversations with the client, just like the family member need to have. And many times I'll find in my practice when I'll sit down, and maybe it's a little bit my personality, but when I have the two generations in front of me, we'll start asking those hard questions. Okay, guys, you can't get insurance. I understand. These are the assets because we need to have full disclosure, right? Let's walk this through. How does this look? Do you understand how this looks? You need care tomorrow. How does this look? And I try to get them to start articulating. If they can't articulate it, then I come back with advice. Okay, let me explain to you how this works. If you own a home, how reverse mortgages work, how if you're going to need Medicaid help, whatever it might be. And then also to understand, to have the parent sit there and talk to the child. First of all, if it's only the parent or it's only the child and they're not both in there, it's going to potentially be a very challenging outcome, because then you'll need the parent to sit down and look at the child and say, okay, I'm not going to have the assets. I am now expecting you to take care of me, which in many cultures is expected. Now, that may be what happens, right? But communicate this beforehand, like in your case, right? Have your family talk about it. And like you said, which child is going to be the one to take that care, right? And because of that, whatever it might be, how the allocations come later down. But for the advisors and the planning on this, the selling the insurance policy is not the only option, right? There's lots of other discussions into this. So as you've gone through and you've talked to your families and they've brought up these regrets, what have you continued to learn? What are you seeing? And what are you trying to communicate to people out there as far as when they're putting this plan together? That okay, let's say insurance is not an option, right? Or it's not there. What are some of the other topics that you think are most important that people need to start talking about right away?
Mhm. To what you're just sharing, like Steve, you're absolutely right in that, like, the type of care preferences, what we found in our like massive proprietary 500 million data set and analyzing so many households, is that every care preference that you share or you make drastically affects how much it's actually going to cost and how it's going to actually affect the family as well. And that's what we focused on, is like the biggest anxieties are around, can I afford this and how can I protect my household, at the same time, whether that actually means like making sure that we don't, like, I want my family members to step in and I want to make sure that we don't end up not having a relationship with each other at the end of it. Or it might mean I actually want to protect them because culturally that means that I don't want them at all involved in my care. But if you only have an insurance like plan and like nothing else, like who's going to be your care coordinator if you're trying to like age at home? If you're trying to figure out, what additional sort of like retirement communities that you want to look into, and you're incredibly frail, and you can't transport yourself to all those different places, like how do you effectively have that conversation with someone in your family or someone that you trust to help you get access to resources, whether it's a care environment or care resources within an environment. So very much that's also the same focus that we have on our side. To what you just shared, like we don't focus on product recommendations. Like, out honesty, I think there's a lot of innovative sort of policy designs. I think there's a lot of financial vehicles that you can actually like tap into on this topic. But what we focus on and what we notice like is a major issue, and what you're like kind of going over again and again, is that motivational hump that families have on this topic. How do you even get them to have a conversation in the first place without it affecting their relationship with each other? That like knowing that it's coming from like a good place, it's coming from like a place of like aligning on goals around like, I want to make sure that you're cared for, and I know that you want to make sure that I'm protected, or the household is protected. So how do we do that? So I'm more than happy to talk about how we're trying to introduce more true planning on this topic, but also happy to take it down whatever.
Talk about that, and I mean we'll go through. It's all about starting this conversation and maybe what you guys are finding, right? It's kind of, it would beg the next question, like who should it be incumbent upon to start the conversation, right? Because it affects everybody. And I think that answer would be anyone. Anyone could start the conversation. And the key to having that conversation is to bring everybody together and just start happening. That the greatest chance for the worst outcome is when you don't talk about it. You're not going to be lucky for it to work out. There's going to be pain, whether financially or other ways within the family. So yeah, I would love to hear, kind of what you guys are thinking, about the planning, like you say, care coordinator. There are a lot of professional care coordinators out there that could help you put the pieces together. I often refer clients to them, but many times individuals, they try to figure it out on their own. And I think there's been many that are successful at it, right? They're successful at it and they can do it. But the challenge is, where do you go? Where's that one repository where you have all that information to where you can get the speed as quickly as possible? So yeah, I'd love to hear about, a few of those things that you guys are working on.
I think I'll share some like insight first, which is like to that kind of like magic bullet question of like, how can I like make sure that, I get access to like, this sort of resource, or what is that one-stop shop that I go to kind of like satisfy like all my needs. Like once I need certain providers, I need certain care resources. I think to that point, like, it's still a very much a broken space in care
Mhm.
coordination and elder care. And I think you could definitely speak to that, like Steve, and all the different experts that you're trying to talk to, or when you had to help families navigate that, definitely would love your like insights like there, because I'm sure that we had a lot of similar themes that
Mhm.
we observed.
Yeah.
And in terms of like what it's hot, like in terms of, how do you start that conversation? Um, for us, we recognize like there are many really talented advisors like yourself that's seen so much, where you've seen enough, where this particular household or client that you're serving, you have that story and that observation to share back with them to motivate them first about like, hey, I want to start talking about this, and I want to share some like a family that like looked like yours, and they had, some devastating effects. I don't want that to happen to you. So here's what I think should happen next. So I think that you're very much an expert to like navigate that. But there's so many advisors that are coming in to, wealth management, like really focusing on deep planning, but had never had a precipitating event in their life and haven't seen enough of it to recognize, how do I even start that conversation, with my
Mhm.
client? Um, and to your point, you could start it with, our focus is that 40 to 60-year-old client. But what we recognize is like the earlier you go, the more likely that you're tapping into the sandwich generation that is so stressed about taking care of their children, trying to make sure that they go through college, or they're worried about their aging parents rather than themselves. And so in that case, you could actually take advantage of that dynamic and be like, well, what if we could create a Waterlily plan for the aging parents themselves, where, the way the software works is, instead of national averages or zip code calculator, we actually leverage AI to tell this client and their household exactly what their long-term care trajectory is going to look like for them, their own story, if they were to do no planning on this topic. So we
Mhm.
actually tap into like, what is that personalized risk for this person? Around what age should they start? Would they most likely need care? How many hours of care? What's more interesting is, how many hours is a family stepping in for care? Despite them having 2 million in assets, we don't care if you have 2 million in assets or 200K. We saw so many households in our data set that had 2 million and above, people that were considered ultra high net worth. And to our surprise, they still leveraged family, which kind of goes against the bias that people have, where they're like, I have, enough capital. So that's where the planning stops. And to
Yeah.
your point, that's actually where the planning starts. Because if you only have enough financially, but you're a lot older, you fall down, you break a hip, you go to the hospital, you're scared and vulnerable. You've never even thought about the topic of someone taking care of you. You just want people you trust to be around you. So who do you most trust? It's going to be your spouse, and it's going to be your kids in this case. And so we actually illuminate, that reality that, if you otherwise don't do any planning, this is how your family members will step in for you, will take care of you, how many hours they're going to step in, and how much that's all going to cost at the end of the day. And it's not about scaring them with like, oh, here are these big numbers. It costs us 300K. There's nothing you can do about it. Let's go figure out how to ensure that. For the first time ever, if you really focus on planning, you do analyze what variables contribute to cost, as well as family burden, which is care preferences. And how
Mhm.
do you align that plan that drastically affects how much it is going to cost, and to what extent the family comes in.
Yeah.
um and so, kind of doubling back into it, like for a client that's 40 years old, many advisors have shared interest in like, well, what if we showed that trajectory to their aging parent, about their aging parent, as a way to prep that client for like what that trajectory could look like for them taking care of their aging parents, and potentially, get some guidance on, now that you know what the baseline looks like, what is that goal? How can you talk to your parents about that goal, and how and align on that, and figure out like, how can we get all the right resources for you in place before it's too late? And when the children realize that at 40 years old, that may act as a natural sort of motivation for them to realize, well, wow, like my parents wait until it's like 5 to 10 years only before they like start to have an event. There's not much financially we could do about that. and it's expensive,
Yeah.
and I'm taking on a good chunk of that, and I feel that pain. I don't want my children to actually feel that pain, like that 40-year-old, that sandwich generation. So that's when they would actually like also then consider building their own Waterlily plan as a way to protect their household and make sure that they financially can, support themselves like on this as a way of protecting their household.
Yeah, so that's a great point, Lily, and I love how you're putting it there. So I think that begs a great question, right? What role would should I don't want to say should, but could the financial advisor play versus the family, and who's doing what? So I mean, I'll start out here. I kind of thinking about it this way, right? Whenever the family comes into your office and my office and starts planning, and we talk about finances and we talk about insurance and ideas and stuff like that, that's really, and not, I'm sorry, and also legal documents, healthcare surrogate, power of attorney, right? Very simple, very vital. You don't have those, you're going to be, dead to start. All those items, the advisor can advise on all those things and talk about it. Do you have it? This is how it works. This is how they all fit together, right? And start talking about that plan. Now, the other side is that when the person actually needs care and care needs to be delivered, the advisor is not going to do that, right? Unless it's their own family. So that's where the conversation is where you have with them to say, okay, not only, is it coordinating the care, but where are you going to get the care? Can you afford care at home? Who's going to give the care at home? If the care at home is being given by a family member, pay them if the resources are there, right? This is not about protecting from the inheritance, right? And that's a big conversation. That family member should be paid, and that's a lot of public benefits, planning that's done there is with the payment items and stuff like that. And maybe should mom move to sister that's in a lower cost state based on all the different items. That coordination of care, the advisor could try to get the family to start talking about it, maybe bringing together, be a part of those conversations. But that's the conversations the family needs to be a part of. And another thing, Lily, and for anybody listening to this, and you nailed it, it's a sandwich generation, right? I'm going through it. My parents are aging, right? My kids are younger, but they're young adults. You, as the child that's being sandwiched, right? Bring your children into the conversation immediately. Oh, but I don't want to burden them. I don't want to care. But that's not life. That's not real. And you're doing them an extraordinary disservice. Allow them to watch how you interact with your parents and to go through these difficult conversations so they're a part of it. And you know what you'll find also is that grandparents many times have a different relationships with kids than grandkids. So grandkids can maybe bring that tough message through, right? Like you with your aunt, right? Your relationship is very different than a sibling, right? Because there's all that stuff that goes down through it. So I think when you're looking at the parties and the responsibilities, the advisor, yes, you can get it together. I think we've established it's much more than just buy insurance, and you can encourage to bring the family together. But then on the family side, the family does have to come together and communicate amongst themselves. And it seems like that's where Waterlily can come in, that it kind of bridges those two roles and gives everybody those talking points.
Yes, exactly. Something we're actually like launching very soon, actually around like the week in our private version, is that focus on the support structure. So we're actually like breaking up, I think that you already do a part of this analysis yourself, given how like, experienced you are, like, which is like, how do we navigate care resources, care environments, care members, how they affect costs in some way. And so for us, we actually project out, not only just like the total amount of hours that we think you'll need, but we're actually going to be breaking that up more granularly, which is important, into care phases. And like, how does your care plan change as you have different care phases, and who's going to step in for that? So for us, we focus on, phase 1 of care, which is like 1 to 2 ADLs, phase 2, 3 to 4, and 5 to 6, because those are very distinct inflections of like where that care could change and how massively, do certain family members need to step in, or certain care members need to step in ways that you didn't expect. And so that's where like you have those hard questions around like, okay, like if I thought about if I needed light phase of care, moderate phase, or heavy phase of care, is there someone I trust throughout the entire process to be like my care coordinator there? Should that like also be my power of attorney, like in some way, both like financial or like on the medical side? So that's one way to think about it. Or for us, on what we do is like, we actually And I think for advisors that are talented enough, they ask all these subtle questions to understand the psychology of this family, actually, around just like, okay, like who's likely to be, the decision maker, who's likely to be like the natural coordinator or whatever else. So we created these 2 surveys specific to the family, where it's like both the future care recipient and the future caregiver. Like, let's just say it's like Michael and his daughter, Sarah. We asked Michael's survey about Sarah, saying like, subtle questions around like, hey, how many fights have you both had in, the past year? How many of those fights resolved? Okay, well, like, does like Sarah like live nearby? What do you think? What do you think? How do you think she would step in if you needed care in like these ways? Are you aware of any other responsibilities that Sarah has that may affect, like any quality of care that she may give you? So we asked sort of like roundabout questions about like trust, or like what's on someone's plate, or what is your relationship dynamic currently? Because like it's not necessarily going to get better, as this person steps in for your care. It actually gets exacerbated. Whatever sort of issues you have is going to open up. So
Yeah.
either like, it's a topic of just like, if you want this person to really step in for your care, either you talk about you better that relationship, so that it doesn't get like ugly in a case of like she really needs to step in, we need to make really hard decisions with each other, or as well as the fact that you may just want to involve her early on, and you could tell her, I think things are going to be hard in these ways, and I have these preferences to make it easier on you in some shape or form, because I really trust you. And so we offer that same survey to her to understand like, where does she stand, because it's a 360 sort of like review that I think the advisor needs to do on both like their clients and potentially the children that are stepping in and coming to the table. Are they a good fit for each other? Like what type of fit for being a physical caregiver, or a care coordinator, or a financial caregiver, for light physical care, for moderate physical care, or heavy? um because that's all going to affect just whether or not the plan blows up or not,
Yeah.
or things kind of stay on track financially as well or not. So
I couldn't just that's awesome what you guys are doing. Like, I can't tell you more. I can't tell you how many times. And really, like you say, it's the person's preference. Like the person will come in, they'll have 4 children. Well, who do you want to be your power of attorney? Who do you want to be your healthcare surrogate? And they say, well, I want this person first for health, that person second, and then it's totally different over there. And they just, and why? Just because, right? That's what they know. That's what they feel. That's they're comfortable with. And then what's important is for those family members to understand that this is what your parent has chosen. Having been an experienced estate planning attorney and probate attorney, all the fights of families come up, the 95%, when someone passes away and something's written in a will or something has happened, and they say, nope, that wasn't what grandma or grandpa or mom and dad wanted. You must have influenced them to do something. It is so much, and I tell every single family when I see they're putting a plan together that might hurt some feelings, you need to communicate this, or you're begging for broken relationships and potential litigation down the line. If they can just get the parent to say it and what they want, that's so vital. And I've seen some people do it through videos. I know that's the different way. Videos, I've heard good and bad in the past. At a minimum, do that, but to get people in the room and try to have that conversation, or maybe do it through Zoom, right? But that's really the most important thing for them to talk about. Lily, listen, this has been great. I know we've gone a lot longer than we were thinking about, but these and so many more. It's such an important conversations, and I think it's just really awesome what you guys are doing. And so having gone through this, we talked a little bit about you, a little bit about your journey and what you've learned through the business. I guess let me do this 2-pronged question that I ask many of the people that I interview here, right? And this typically goes towards their business, right? But I can also apply this to your personal situation, right? Or the experiences you met through interviewing these different families. That if you could go back, whether it be 5 years, 7 years, 8 years, and tell younger Lily something that you know now that you wish you knew then, whether business or personal, right? We've gone through all these things. What would you tell yourself you think that would have maybe improved whichever outcome?
that's a really great question. I would be kinder to her, actually. I think that when you're young and ambitious and you want to see change in the world, it's really easy to be hard on yourself because everyone else is actually being critical of you, of just like, they're judging, you're getting judged all the time. We're thrown into the world where it's incredibly judgmental. And we're judged on our credentials, what we've achieved, and like whatnot. That gets associated with our very easily for someone that's young with your sense of value as well. And I think that what's really important is like to be able to explore and build without judgment. And then focusing on like, we know what really matters to you, just like, what do you care about? And recognize that there's going to be people who have decades of experience, like in your industry or whatever else, that feel like they can share a lot of critiques to you about how you're doing things wrong and whatnot, but nothing that's ever really transformational, is ever like easy to understand, like, or to know about. And like, there's a best practices way in which you go and build that. And so I think for myself, I would tell myself to just like be kinder to myself, and allow myself to really explore and care about what I do without being so worried about what other people think.
I love that answer, Lily. And I would add to that, having gone through this a lot, not also be kinder to yourself and empathetic to yourself, but surround yourself with people that are kind and empathetic, right? That will make everything so much easier. Get rid of the a-holes, because you are who you surround yourself with. And I love that. I love that answer, and really try to surround yourself with people like that. That's why I do what I do now. That's why I don't practice law anymore, right?
The conversation for another time, right?
That's a whole other conversation. Listen to my other podcast. So Lily, I really appreciate your time, and this has been awesome.
Amazing. Well, thank you for having me on, Steve. I really enjoyed the conversation, and I hope it's one of like many to really dive deep on this topic, since we barely scratched the surface.
You got it. Absolutely.
Awesome. Thanks so much.